I'm Frances Elliott, the Medical Director of NHS Fife, and today I'm going to talk about why research is important to me. From a medical perspective, research is hugely important to this organisation. It helps us to identify the important treatments for patients and to really understand that they will be clinically effective. It's also important because we can learn from research about what really works and in what kinds of patient.
What research means to me, it's all about the patient. It's giving the patient the opportunity to be involved in research, to have access to new medicines, to be able to be part of what's new and happening in the healthcare system.
12 years ago I had a severe angina attack and a small heart attack. The treatment I received in hospital was second to none, and the aftercare, which is still going on of course, is superb. That is all because of research that's gone on before I had my intervention. And to be honest with you, it's just fantastic. I am probably healthier now than I was 12 years and 1 month ago.
I think research is important to improve patient care and treatment by giving the population of Fife the opportunity to take part in clinical trials.
I was very anti-research as a junior doctor. I didn't think I knew enough about the specialty to know what the questions were. But since becoming a consultant, I think it's hugely important that we take part in research for all sorts of reasons.
As a research nurse, I've supported a number of studies across the organisation, and including 2 European studies.
I feel that research is very important because we need to know that what we are doing when we're working with our patients is effective, and we also need to know what their experiences are and try to understand these experiences.
If there had been no research before I had my intervention, then where would I be now? I might have been dead from a heart attack. I might not be feeling terribly well, and I might still be having angina attacks and heart attacks.
Research is crucial to me to help our journey of changing the culture in which we provide healthcare.
What's most important to me about doing research in NHS Fife is that we have the opportunity to work with patients and clinicians to ask precisely the questions that are most important to them. And the knowledge that we generate, we can then apply directly. Yes, we can share it with a wider community, but we can actually make the differences to the service we provide.
It allows not just the consultants but the trainees to constantly think about what they're doing and not simply be hamsters in a wheel, if you like. And this is something that's part and parcel of being a doctor and should remain with you in all your years of practice.
Key for me in research is that we have excellent collaboration with our academic partners.
Research for me is one of the most important parts of my career because it's where I get to answer some of the really difficult questions in medicine.
During my 2 days secondment in Fife, I worked closely with R&D team and other clinicians to upload data from Fife to our datasets in Tayside. We take the data, we clean it, we maintain it, and we give it back to researchers, link it with other datasets, other national datasets, to help researchers to do lots of research to improve the health and well-being of the people in Fife.
Doing research is always challenging, and with the few projects I've done in NHS Fife, it has been incredible to have the support of the Research and Development Department. They're so visible, they're there providing a whole wide variety of support. I owe the R&D department in Fife the start to my research career, and having just completed a PhD, it all started with the support of the department.
I'm involved in several research studies. Some of those have actually changed practice, and the CLOPS trial, for example, has led to changes in the sign guidelines for stroke.
So one of the exciting projects in urology is that we've obtained European funding to look at a unique molecule in urine that could potentially help urologists work out what patients need a follow-up cystoscopy after bladder cancer treatment.
Research is very important to me actually because this is the field of my experience, it is my passion, and I would like to help people through my experience, and that's why I chose to volunteer in the R&D department.
Having worked in Scotland, England and Ireland, I think our research and development department here in Fife is one to be very proud of. Colleagues from across the region and indeed from across academic institutions tell me that our R&D department is best in class, and we should be very proud of that.
We started off in a small room in Queen Margaret with just Amanda with her amazing ideas about the future, and now look what we've turned into. We've got a super environment. We've got 18 people on board who are all working towards producing brilliant quality for research in Fife, and it's just grown from strength to strength, and I'm proud to be a part of that.
There's research to show that the care given by hospitals that are taking part in research is itself better, and I think that's part and parcel of that whole thing, that if you're researching, you're caring about the subject, you're passionate about it, and you want to stay up to date.
I decided to take part in the Reveal research development after seeing it advertised in the newspaper. It was one small way for me to give something back for what I received from the NHS.
We all understand that where good clinical care and good academic work conjoin, good things happen.
I can't answer on what it's like to do research in Fife. All I see are the outputs, and it's really important that our clinicians are active, that they can shape what happens in the future, and that we can do the best we can for patients in Fife.